Psychologically, the condition of a person who becomes confused or overwhelmed by religion to the point of being unable to function in daily life can be understood through a combination of psychological, social, and religious factors. Not every case represents a mental illness, but there are recognizable patterns in the psychology of religion. First, there is religious cognitive overload. This occurs when a person attempts to follow religious teachings with extreme perfectionism beyond normal human capacity. For example, constant fear of committing even minor sins, fear of God's judgment, or fear of eternal punishment. The mind remains in a persistent state of anxiety, which significantly impairs everyday decision-making such as working, maintaining relationships, or basic self-care. Second, there is religious anxiety or scrupulosity. This is a form of anxiety strongly tied to spiritual fear. Persistent doubts about whether one's faith is genuine, whether one is saved enough, or whether certain thoughts are blasphemous. Clinically, this is closely related to obsessive-compulsive disorder, OCD, where individuals may spend excessive time praying, confessing, or seeking reassurance to the extent that normal life becomes paralyzed. Third, there is identity conflict. The individual may feel torn between religious expectations, from church leaders, doctrine, or scripture, and real-life psychological needs, work, emotional expression, personal goals. If they have internalized the belief that personal needs are worldly or sinful, they may suppress emotions and desires, leading to depression, confusion, or loss of life direction. Fourth, unexamined religious authority can play a role. In Christian environments that emphasize fear, control, spiritual warfare, demons, curses, or prophecy, the mind may begin to interpret ordinary life problems as spiritual attacks. This weakens rational problem-solving and increases dependence on religious guidance rather than personal agency. Fifth, there may be an underlying mental health condition such as depression, severe anxiety disorders, or psychosis, in which religious content becomes the framework through which symptoms are expressed. In these cases, Christianity itself is not the cause. Rather, the illness shapes how religious beliefs are interpreted and experienced. From a clinical psychological perspective, the solution is not necessarily to abandon religion, but to establish boundaries between faith and mental health. This may include psychotherapy, especially with clinicians familiar with religious issues, learning non-fear-based interpretations of faith, and in some cases, medical treatment. A person whose daily functioning collapses due to religious confusion is often struggling not with God, but with fear, guilt, and psychological burden expressed through religious language. The psychological goal is to restore balance between faith, the mind, and practical daily life.